Hello, everyone. I'm Athanasios Saratzis. I'm a professor of vascular surgery in the United Kingdom, recently appointed as NIHR Research Professor in vascular surgery. And I'm going to try and convey some information about two new important randomized controlled trials funded by the NIHR, which is the National Institute for Health and Care Research in the United Kingdom. These are big randomized controlled trials involving patients with peripheral arterial disease, and they're going to take place across the NHS. So very important studies, effectiveness driven, and they're going to guide future guidelines and obviously future care for vascular patients. So these are, in a nutshell, the important PAD-related trials right now funded by the NIHR, the British Heart Foundation in the UK. Some of these are already open, but I'm highlighting here the two ones I'm going to focus on this short talk. The first one is called RAVE, and it involves people with peripheral arterial disease and calcified arteries. And we're going to compare the use of IVL, intravascular lithotripsy that is, against the use of other types of vessel preparation, and look at outcomes after the procedures that these patients have undergone. And the second one, which is a very interesting study, it involves people with common femoral artery disease of steno-occlusive nature, and it's going to look at open surgery and atherectomy of the common femoral artery in most cases against endovascular treatment of any description, using mostly the new tools that are now out there, like intravascular lithotripsy, atherectomy, DCB, and various other devices. So in a nutshell, these are the PICOs of the two studies. The first study is called RAF or RAF. It's the study that, as I said earlier, involves people with either CLTI or severe claudication who have got steno-occlusive disease of the common femoral artery, and they require revascularization. So these are people that have already been chosen to undergo treatment of some description. And that treatment is going to be arm 1, endovascular treatment of any description, versus arm 2, open surgery, again, of any description. So a pragmatic trial. And we're going to leave the choice of open surgery and the choice of endovascular treatment up to the investigators at each site. They'll be able to use whatever technology they wish to use. They'll be able to use whatever patch or type of closure they wish to perform. The primary outcome measure is a composite outcome of all-cause mortality and or reintervention, such as major amputation or leg revascularization, after obviously the index procedure. We'll be doing a full health economic analysis, and we will also look at people's quality of life. So we're powered to look at that composite outcome and powered to detect differences in people's quality of life after their treatment. The primary analysis will be intention to treat, but we will report per protocol analyses and subgroup analyses as well. The RAVE trial, which is the second one, again opening in 2026, is going to involve 306 people having endovascular revascularization of their lower limb arteries, where the operators believe that lithotripsy can be used. So we're talking about people with calcified arteries that might need some form of vessel preparation, such as lithotripsy. The intervention is the application of IVL as the first-line vessel prep versus the usual care, which is no use of IVL. And again, we're looking at a pragmatic trial where the operators can choose whatever kind of device they want to use before and after the application of IVL. The primary outcome measure is again a composite of mortality, all cause, and or reintervention, such as amputation or major leg revascularization. We're again powered to look at quality of life differences alongside this composite primary outcome measure, and we will be performing a full health economic analysis. So these are the two important trials. Important dates about those trials for the people that wish to get involved. We've only just started to sign contracts and prepare the documents for the 2 trials, and they will be opening at some point early to mid 2026. If you do want to open your UK hospital for one of those studies, now is the time to get in touch so that we can get you acquainted with the team running the trials, and that's Leicester Clinical Trials Unit, and we can get in touch with your research and innovation departments. This is, again, in a nutshell, a summary of all of the studies taking place across the UK in terms of major RCTs driven by effectiveness, both clinical and cost effectiveness. As you can see, there's a plethora of studies. I've just covered the 2 new ones, that's the RAVE and the RAF trial. So please do get in touch if you're interested in opening your site for recruitment for any of those studies, and we can advise you accordingly.